Welcome, welcome, welcome. Dr. Triphi here with you. I am talking today about broken heart syndrome. Now, is there such a thing? Uh, do you believe there is such a thing? Do you think you have a broken heart? And if so, how can you tell? How do you know it's not real? Am I having a heart attack or do I have heart problems? Well, broken heart syndrome is a thing. It was named after Dr. Takotsubo. It's called Takotsubo cardiomyopathy or stress induced uh, cardiomyopathy. It's usually temporary. Dr. Takotsubo is the one who is given credit for identifying this. Uh, it's a temporary disruption of your heart's normal pumping function in one area of your heart. It's often your heart's response or the heart's response to a surge of stress hormones such as adrenaline. We're not sure yet how these hormones might hurt your heart or whether something else is responsible. That's not completely clear yet, but knowledge increases every day. So, some triggers of a broken heart syndrome include a sudden death. You get news of a sudden death. You learn you suddenly lose your job. Even a surprise party. Losing or winning a lot of money. Divorce, separation, and breakups are biggies on that list of triggers. Okay? So, in your body, physically, you might feel as if you're having chest pain, shortness of breath. The symptoms can actually mimic a heart attack, which is why it's so crucial if it feels as if you're having heart pain for whatever length of time. Call 911, call your medical professional, get some help, go get yourself checked out, tested. Medical professionals will let you know what's going on. The difference between a heart attack and broken heart syndrome symptoms are that heart attacks are caused by a complete or near blockage of a heart artery, whereas in broken heart syndrome, the heart arteries aren't blocked, although blood flow is going to be temporarily restricted. Now, who is at greatest risk for broken heart syndrome? Ladies, you are. Broken heart syndrome affects women far more often than men. Older people, as in 50 plus, if you're 50 plus, you're at greater risk. If you have a history of a neurological condition, as in you have a history of epilepsy, seizure disorder, or if you're suffering from or have a history of past psychiatric difficulties like anxiety or depression, you are at higher risk. In rare cases, broken heart syndrome is fatal, meaning the literature is right. All the old songs are right. Feel like you're dying? Yeah, you can die of a broken heart. Okay? Other complications include backup of fluid into your lungs. It's called pulmonary edema. Disruptions in your heartbeat. Again, heart failure. Go to the hospital, call 911, have yourself checked out. They can do stress tests, blood tests to rule out if you're having a heart attack. But if you know you're just getting over a loss, as in recovering from a breakup, you want to go get yourself checked out because you don't know if it could progress into something fatal. They say love kills. I guess, yes, it can. I mentioned getting over a breakup. What complicates that sometimes is our detoxing from oxytocin bonding. So, oxytocin is the hormone that the brain releases to help us connect and stay connected to people. I mean, we react to it as if it was heroin. We react to it as if we were getting off of a drug. So some of the symptoms, I mean, you, this is perhaps why you're looking at this. You have history or you've seen other people with this compelling need to get the other person back. You know, you're a proud person, you end up on your knees begging, please take me back. Your brain reacts as if you are withdrawing from a drug. Biologically, it can take up to 2 years and more for some people to recover from oxytocin addiction, if you want to call it that. Within that time frame, then, it is better for your heart if you avoid the stimulus of that oxytocin trigger. Resist your cravings to see, smell, taste, sometimes even hear the person if you can. You've decided you're breaking up, they've decided they're breaking up. It is what it is. If you're ready to recover, this is a crucial step. Long-term recovery tools for broken heart syndrome. Start getting back out there. Increase your social and emotional support network. If you don't have these people in your life who you feel like you can depend on and lean on, create new relationships. Go to meetups. Find a therapist. Get a pet. You might need medication to help you through anxiety and depression. You might need medication, and it's perfectly okay. If you had diabetes, you would go find that insulin shot, wouldn't you? Same thing for anxiety and depressed mood. They can kill you. Do a post-mortem on your relationship. I mean, try figuring out, what did I do wrong? What did I not do wrong? What lessons do I need to be learning from this event? Journal your thoughts and feelings. Pour it out. Get it outside of you. Get the pain outside of you. Translate your emotions into words. Do physical exercise, yoga, movement, dance, Zumba, run, walk. Begin to retrain your brain to reorient itself towards love and feeling good. What do I want to encourage you to do from here on out? I want you to remember that broken heart syndrome is a thing, and your job is to protect your heart, to guard your heart, even as you offer it to others in relationships. So moving forward, please use the tools I've suggested to help you recover. If it feels like you need medical help, reach out and get medical help. If you need mental health support, reach out and get mental health support. You are not crazy because you're in so much suffering after a breakup. It's the brain's way of really, even if a person is bad for you, the brain wants you to stay connected and have babies. So it just feels like hell. But there are ways to take care of yourself. Feel free to go to my website, www.drtriphi.com. That's drtriphi.com. Check me out on Facebook, Twitter, Instagram. I do a lot of tips. I have a group, a Heartbreak Recovery group. Please join. Connect with other people going through this process with you. Find a support group, connect yourself. Social support is fabulous, and it's proving, based on research, to be one of the ways we really make our way through in life. So if you don't have that network around yourself, create it. Create it. Again, my name is Dr. Triphi. I wish you the best in creating your ideal relationship. Peace to you.